I'm Dr Karen Treisman, clinical psychologist, author, and trainer. I just thought I would share a few thoughts that have been whirling around in my mind for the past few days in the hope that they're going to be helpful for some people out there. I guess I'm just really mindful that at the moment lots of us are feeling quite dysregulated, are in our survival mode, are in a period of shock and uncertainty, and for some people those are going to be quite unfamiliar new feelings, and that's going to feel quite overwhelming, quite alien, quite confusing, quite discombobulating, for want of a better word. But for many other people, these sorts of feelings and sensations might be ones that they have experienced many times or have still experienced, or are ones that they experienced in the past but are being resurfaced or re-triggered or exacerbated. And I think at the moment what we're doing is we're operating in a community trauma situation. We're operating, a lot of us, in survival mode. And there's a lot of stress contagion, dysregulation contagion, emotional contagion. So not only are we trying to process and reflect and make sense of all of these different feelings and sensations and thoughts of our own, but we're also absorbing and soaking and being marinated in lots of other people's thoughts, feelings, sensations, and we really are containing and holding lots of that. But I just wanted to put a bit of a spotlight on past traumas. For people who have experienced this, I hope that this will resonate. For those who, and for some it will and for some it won't. Obviously there is no cookie cutter approach and we're all unique. But for other people, this might be quite a new thing to think about. And I think when we're in a place of trauma or stress or fear, we use creative coping skills, strategies. We are operating often from a place of survival. And some people, and most people, will do various different ones, and it will go in ebbs and flows and oscillate between different ones. Some people might retreat, might disconnect, dissociate, down-regulate, shut themselves away, numb themselves. Other people might be going into attack mode, might be feeling much more agitated or irritable. And that, often better to be powerful than powerless, better to attack than be attacked. We know that for many people, anger is a bodyguard emotion, anger is a mask emotion, anger is a camouflage emotion, it's married to pain, fear, sadness. Other people, it will be spilling out through their bodies. If our bodies could talk, what would they be saying? It'd be coming out in physical sensations and feelings. Some people will just be feeling so full up and their brains will be absolutely full and almost like a spaghetti head, so it will be hard to be doing anything or thinking. I know that I'm struggling to write an email at the moment. And different people will go through lots of those different ones. There's so many different strategies. But I think what I really want to think about a bit today is that for those people who have experienced past, or it might be ongoing, trauma, this might be taking people down a memory time hole, down to a time where you have felt those feelings, those sensations, those associations before, and that can feel really dysregulating and overwhelming. Think about those who might be feeling at the moment unsafe, boxed in, powerless, out of control, uncertain. Those that this is highlighting areas of poverty, of injustice, of equity difficulties. Those who are feeling much more alone, or not heard, or not listened to, or invisible. Those who are feeling in a place of stress and fear and have those different feelings. Imagine what that's like on a community level. Northern Ireland, South Africa, all of those different countries where that historical, community, cultural, collective trauma might be sending lots of people down a time hole to those times, to those feelings. For those, for example, who have lived or are living in domestic violence situations, in situations of abuse, how many of those feelings are going to be resurfaced and triggering and taking us back to those? So I guess I'm sharing this with the hope that it's just going to be quite validating. It's going to help acknowledge some of the things that people might be experiencing or feeling or might experience, that it might help other people who aren't in this framework to have some compassion and empathy and understanding, that it might connect some of the dots, and that can also help us to be patient and kind and compassionate and empathetic to ourselves. I hope that that gives a little bit of thinking or a springboard for further discussions, and I'll continue to add to these. I'm sending positive vibes and I'm thinking of you all. Thank you.